Hi everyone, just for another quick update. I just wanted to let you know that we are inviting everybody in Phase 1b to reserve their COVID-19 vaccination with us. And I'll explain how to do this shortly. But I just wanted to really quickly run through all of the people that are eligible for Phase 1b. It seems rather difficult to work out who's eligible and who's not online, so I thought I'd provide a little bit of a summary, and if you meet any of the criteria as I go through them, then you are eligible for Phase 1b and you can reserve your COVID-19 vaccine right now. So Phase 1b includes all healthcare workers, essential carers, so not the family members of people being cared for unless they are the essential carer for that person, disability support workers and disability support volunteers, critical and high risk workers including emergency service personnel, the frontline police officers, fire and rescue personnel and corrective service officers. The rural fire service and state emergency services are eligible. The active Australian Defence Force personnel, workers at licensed meat processing businesses including abattoir workers. However, this does not include retail workers in butcher shops, fishmongers, etc., but does include abattoir workers. All people over the age of 70 are eligible for Phase 1b, no matter what their medical background is. All Aboriginal and Torres Strait Islander people over the age of 55 are eligible. Anyone who is immunocompromised, this includes transplant recipients, adult survivors of childhood cancers, bone marrow transplant recipients, people with HIV or congenital conditions that cause an immunocompromised state, blood disorders including leukemia, lymphoma, myeloma, other types of cancers that have been diagnosed in the past 5 years, or cancer that is an active treatment including chemotherapy, radiotherapy, immunotherapy, chronic inflammatory conditions including lupus, rheumatoid arthritis, Crohn's disease, ulcerative colitis, people with chronic renal failure and have to have the kidney function measure being less than 44, or what we call the EGFR. So if that's less than 44, then you are eligible. People with mild to moderate kidney disease are excluded at this stage. People with heart disease, including those with ischemic heart disease, heart failure, cardiomyopathies, pulmonary hypertension. People with chronic lung disease, including chronic obstructive pulmonary disease or COPD, cystic fibrosis, interstitial lung disease. This does not include mild to moderate asthma, but does include severe asthma. People with diabetes, any type of diabetes, just having a diagnosis of diabetes makes you eligible for Phase 1b. People who have severe obesity with a body mass index above 40, people with chronic liver disease. There are some neurological conditions that are covered, including stroke, dementia, multiple sclerosis, motor neurons disease, Parkinson's disease, cerebral palsy. People with poorly controlled blood pressure, so people with blood pressure that are only on one medication are not eligible, but people who have blood pressure problems or hypertension that have 2 medications to treat it are eligible, and that doesn't matter what your blood pressure reading is. If you're on 2 or more medications, you are eligible. Those with Down syndrome, those with muscular dystrophy, and those with spinal cord injuries. So this is just a bit of a summary of everybody who is currently included in Phase 1b, and just try to give you a bit of advice as to whether or not you may or may not meet the criteria. Now, once you know that you're eligible and you've met the criteria, you do have to be aware that we will need to have some form of proof prior to proceeding with the immunisation. And if you're already a patient of our practice and you're attending us to have your COVID-19 vaccine, then we'll have your medical record and that will suffice. Okay, but if you are having your vaccine and we are not your normal healthcare provider, then you will need to bring along a health summary printed out from your medical records stating the medical problem that gives you eligibility for the COVID-19 vaccine. Or you could provide a script that demonstrates a medication that would be used for one of these conditions that would meet eligibility. If you can't provide proof, but you know that you're eligible, there is a declaration form that you can sign and give to us for us to keep on file, just so that we know that we're immunising everybody who is currently eligible for Phase 1b. So, if you have decided that you are eligible, the best way to reserve your vaccine is to go to our website, www.healthhubeatonfair.com.au, go to the top right hand corner of the page and click COVID vaccination. Then enter your details, scroll to Phase 1b COVID vaccine appointment type, and you just click book appointment. It'll then ask you to reserve your vaccine. You can also do this via our AMS Connect app. If you are unable to do this online, then please call us on 9707 2793 and one of our receptionists will help reserve your vaccine for you. Then, what happens next? Once we receive the COVID-19 vaccine in stock and we have it in the clinic, then you will automatically be notified when it is your turn to have the COVID vaccine. Once you get the text message or the invitation saying it's your turn for your vaccine, please book your appointment within 48 hours of receiving that text message notification. Once you book your appointment, you'll be given some further advice and some instructions closer to the time of your appointment, so you'll know exactly what to expect throughout the vaccination process. So I hope you found this information helpful, and don't hesitate to ask your usual general practitioner if you have any questions or concerns about COVID-19 immunisation. And have a good night, everybody. Bye.